Okay, so very often you may have weakness in your glute muscle. You have to ask yourself why. One of the reasons why is because your pelvis and low back may have some obliquities. Typically what we find is that you will be restricted left to right versus right to left simply because 80% of the population is right-handed, and we tend to see, because of that, the sacrum a little bit torqued to the left. When that happens, that will cause inhibitory weakness of the glute muscle, and the reason it's weak is because of the length-tension relationship of muscle. So if my thumbs represent the distance of the muscle, and these are the fibers, too long of a muscle doesn't have as much surface area, so it'll be weak. Too short, same thing. If I can do a technique to create symmetry in the obliquity, I now have full surface area, and now my muscle is going to be strong. So the self-correction for a torsion in your sacrum is called the door squeeze. I'm going to demonstrate a left door squeeze because, again, 80% of the population being right-handed, you're typically going to see a left on right torsion that will restrict your movement. Okay, so we're going to demonstrate a door squeeze for self-correction of a torsion in your sacrum. For purposes of demonstration, I'm going to show it on the right side. The idea is to get the left leg and foot in front of the door, the shoulder behind the door, and you're simply squeezing the door for about 5 seconds. Typically what we have patients do is squeeze the door for about 5 or 10 repetitions. Once completed, and if I were to do this on the left side, and I had my restriction on the left, you will typically see a restoration of movement. Once the restoration of movement has occurred, we've allowed the length-tension relationship to change, and when we go back and test the strength of the gluteus medius muscle, we will find that it will show 5 out of 5 or full strength on the table.